Hey everyone, Ryan here, and welcome back to our patient management series. So this video will be about communication and interpersonal skills. And good communication will separate an okay dental practice from a great dental practice. So let's talk about a couple of techniques you can employ for great communication with your patients. So the first is active listening. This is actively listening to what the patient is telling you. So this involves preparing to listen by setting time aside free from distraction. So be present for the conversation with the patient only. No other conversations going on in the background. Repeat back what you hear or paraphrase. So paraphrasing is a great tool to help the patient feel confident you're hearing what they're telling you. So, for example, if a patient says, "My sister had her wisdom teeth taken out and she said it was very painful," what if the medication you give me isn't strong enough? So, a good first response would be to repeat back what she told you in a little bit different wording and say, "Well, it sounds like you're worried that you might not have enough pain relief for when you get home." So, that's an example of paraphrasing. And it's actually a great trick for everyday life. So give it a shot. But you should not be paraphrasing all the time. Certainly not paraphrasing actual facts. So be direct and clear when discussing things like diagnosis, treatment, etc. Other things you can do to facilitate active listening are leaning forward, maintaining good eye contact, physically facing the patient, so turning your body towards them, asking questions if necessary, nodding, smiling when appropriate, and maintaining close proximity, but not too close. You should be at a comfortable speaking distance, and tapping their shoulder for encouragement is about as close as you should get to the patient. So our next thing is rapport, and rapport is a mutual sense of trust and openness between individuals that, if neglected, compromises communication. So this just comes down to being human. Ask about the person's interests, school, work, family, what they do for fun, find out what they're passionate about, and maybe even write a progress note for yourself for future interactions so you can bring it up again at future appointments. And you can disclose some personal information as appropriate. So maybe you see that they're wearing apparel for a certain sports team, and you might be a fan of that team as well. So you can talk about that and bond over that. So these are examples of how to establish rapport with a patient. Empathy is another important aspect of communication, and it's the ability to understand and share the feelings of another. So some people say it's like putting yourself in their shoes, and it's closely related to establishing rapport with someone. Empathy is about reflection and showing understanding, acknowledging their concerns, staying open-minded as well. But it's not about sharing your own personal experiences. Empathy is not an invitation for you to vent to the patient. If they're experiencing a lot of tooth pain, it's better to acknowledge their concerns than to dismiss them and then reroute the focus onto yourself and say, "Well, you know what? I had a really bad toothache last week, so I know what you're talking about." It's better to reflect and show understanding, make sure you're acknowledging their concerns and keeping them the focus of the conversation. So let's give another example. Let's say you're doing a restoration and the caries goes to the pulp and a pulp exposure occurs. So you explain to the patient what happened, and let's say they get angry or maybe even call you incompetent or blame you for what just happened. So showing empathy is not always the easy thing to do, but it is the right thing to do. So it would involve recognizing their concerns and saying something like, "I can see that you're upset and you thought that the tooth could be restored, and now this thing happened." So I find that it really helps to think about this as first paraphrasing or putting in your own words what the patient told you. and it's that active listening technique that we just talked about. So all three of these, active listening, rapport, and empathy, are intimately related and important concepts for communication. So we've been talking about this throughout the video, but nonverbal communication, or body language, is continuous, automatic, and very informative. So it's also important to be aware of your own body language, but we're talking here primarily about reading a patient's body language. And the first and most common reaction of discomfort by a patient is with eye and eyebrow movement. So definitely focus on that part of the face and you'll get a lot of information from it. And you can often tell whether or not a patient is listening to you by looking at eye contact alone. And the other side of the coin is, of course, verbal communication. And this is what we're often more times thinking about. For good verbal communication, you should be simple, specific, and direct. And do not just give advice to the patient, but instead provide information and education and allow the patient to make an informed decision. This goes back to informed consent and patient autonomy from our last video on ethics. Do not falsely reassure and say everything will be fine or don't worry. And this is a pitfall of communication, and honestly something I struggle with because it's so easy to just tell them, don't worry, you'll be fine. And this is really important to think about because it might be easy for the person in the white coat to say this because they're not the one sitting in the dental chair. So it's better to say, this injection will likely pinch and sting a little bit, or pulling this tooth under local anesthesia will likely result in a lot of pushing and pressure that you'll feel. So making expectations clear is a much better strategy than prematurely reassuring them that everything will be fine, you won't feel anything, which can compromise their trust and rapport with you if the outcomes are inconsistent with what you promised and asserted at the beginning. So let's talk about some specific applications of good verbal communication. And clinical interviewing is something we often do with patients when we're asking them questions to get more information. So the first type of question here are the open-ended questions, and these allow the patient to explain what's important to them. So if a patient comes in for an urgent care or a limited care treatment, you may not know why they're there. So a good thing to ask them first would be, what brings you in today? Or how can we help you? And this opens the door for them to answer by saying their chief concern or what they're there for. Closed questions, on the other hand, elicit more specific information. So this would be like, do you require pre-medication before we treat you today? And that's a simple yes or no answer. Although some patients might give you a little more information than you asked for. Leading questions direct the patient to respond a certain way, and these you should never use. So this is something like leading the patient to say a certain answer, and you could bias their answer and not get a genuine response from them. Probing is a certain type of open-ended question, and so this is in order to gather additional information. So the perfect probing example is, tell me more. So if a patient says, this tooth really hurts in the top right, you say, tell me more. You want to find out when it started bothering them. What kind of pain is it? Does it keep them up at night? And you can just ask, tell me more, and you can get a lot of good information that way. And the last thing is a laundry list type question. So ask the patient to respond from a menu of choices. So is the pain sharp, dull, constant, or throbbing? Give them several options to pick from to help them narrow down a selection. And lastly, let's talk about verbal communication in treatment planning. So it's best to present treatment alternatives to a patient in descending order of desirability. This is actually really interesting. So the best way to express a menu of treatment options to the patient would be to say first your treatment of choice, And don't say it's your treatment of choice, but just list it as the first option. Then option 2, option 3, then no treatment, and maybe end with referral or a second opinion. And the patient is subconsciously more apt to pick the first choice if they know you're listing it clearly first. Only present options that are consistent with your standard of care. The standard of care being the lowest acceptable level of care among members of the dentistry profession. This goes back to, again, patient autonomy. We should respect their needs and desires, but also don't compromise your standard of care. And ask the patient what his or her understanding is of the treatment options to verify their understanding. And this is known as the teach-back method, which is really, really useful in practice. So ask them to repeat back what they heard so you can get an idea of essentially if they were listening to you and if they comprehended what you were telling them. If you use really technical jargon, they may not understand what you want them to. So communication is, after all, a two-way street. So that's it for this video. Thank you so much for watching. If you're interested in supporting my channel, please check out my Patreon page. A huge thank you to Michael Raja, Eins Lau, David Jaden, Yanet, and all of my patrons for their support. You guys have been incredible. You can unlock extras like access to my video slides to take notes on and practice questions for the board exams. So go check that out. The link is in the description below. Thanks again for watching. I'll see you all in the next video.